Hello, thank you for calling our antenatal on-call clinic. This is Talia, one of the midwives on call today. Would you mind telling me a little bit about yourself and what has made you call this service?
Hi Talia, my name is Zara. I am currently 28 weeks pregnant with my first baby and I'm really hoping for a natural vaginal birth. I'm also thinking about potentially formula feeding my baby because it's just easier. I've been attending antenatal classes, I guess, but I'm still a bit unsure of what's best. I really want to discuss a few queries regarding this as I've had conflicting information from family, friends, social media. I guess I just want to make sure I'm doing what's best for my baby. Is it okay if I just talk through my thoughts with you?
Yeah, no, absolutely. I'm here to listen and empower your thoughts and feelings regarding this process. So tell me a little bit about what you want for your birth.
Well, I strongly believe that actually medical interventions during my birth is not good and I should avoid them. I think that'd be best for my baby's long-term health. So really having unmedicated birth with no instruments is ideal and what I want. But I guess if it's necessary for my baby, then I understand that it's required.
Amazing. I love that you have a good idea about your wishes for your birth. It sounds like avoiding medical interventions is an important part of your birth plan, so I will make a note of it on your file so the team is aware. Now, you did mention you potentially wanted to formula feed your baby. Can I just ask, what has influenced your thought process towards this?
I guess I've just heard that fed is best from some of my girlfriends. I've also seen on social media that, well, formula is just as good as breast milk and that formula-fed babies sleep better. So why wouldn't I want to? Getting good sleep's very important. I guess I'll just formula feed. It's much easier.
Okay, so from my understanding, you have a few concerns regarding breastfeeding and getting enough sleep. Do you want to discuss some of this together?
Well, yeah, I guess I probably should. I mean, you're the expert. But my mum and sister switched to formula feeding only after 2 days because breastfeeding was really hard. They didn't have enough milk. I guess I'm just really worried that I'll be the same. Like, I'm not going to go to all that effort if it's not even going to work.
All right, well, today, do you want to set an achievable goal together that can work for you?
Actually, yeah, that might be a good idea now I think about it.
What do you want the goal to be? It can be a small goal.
Well, I guess the goal is really just to understand what the benefits of breastfeeding might be and how I guess I can make it work for me if I do decide to take that route so that I can make sure that I'm equipped.
That sounds like a good goal. We can definitely work on that together. How open are you to discussing some things about breastfeeding right now on a scale of 1 to 10?
Probably about an 8, actually. I am open to learning more, but that definitely does not mean that I'm going to breastfeed. I guess I'm just open to learning.
Yeah, no, that is so fine. I understand all your worries. There is no right or wrong choice when feeding your baby, and every woman has a very different experience regarding breastfeeding and managing sleep. Is it okay if I just share and discuss some benefits of breastfeeding with you now that I've got you and how you might be able to manage your sleep schedule too?
Yeah. I'd actually like for you to share some information with me so that I can make sure that I have all the information I need to make the right decision for my baby.
Okay, breastfeeding has many benefits, including increased bonding between mother and baby. It provides numerous benefits, including immune protection, optimal growth and development, and reduce the risk of chronic diseases, illnesses, and death. Breast milk can also reduce adult diseases such as diabetes and heart disease. You can also hand express colostrum to keep for your baby when they're born if you're worried about low supply, and I can provide you with some resources on that now if you'd like.
Really? I guess you should tell me more about that then.
Okay, in regards to sleeping, keeping a regular bedtime routine, keeping low lights at night, and getting sunshine in the day can encourage good sleep hygiene. I know you mentioned earlier that you had read that formula-fed babies sleep better, but I would say that mum's milk is designed to be perfect for babies at different times of day. So at night time, milk has more melatonin, the sleep hormone, in it to encourage babies to sleep.
Okay.
However, it is normal for your baby to wake overnight to feed as they can only hold small amounts of milk in their tummy. Making sure you work in partnership and communicate with your partner to ensure you both get a good night's sleep is important. A good option might be to wake your baby to feed and your partner can help settle and put them back to sleep after that feed.
Wow, that does actually sound like it could be achievable, but also on the other hand, that's a lot of things to do. I guess you did mention hand expressing earlier and all about colostrum. What on earth is colostrum?
Okay, colostrum is like liquid gold. It's the first fluid made by your breast that helps to colonize your baby's gut with healthy bacteria to protect against allergy and disease. It is important to note that breastfeeding can take a while to establish, and it's normal to pretty much have nothing in the first few days. It's so important that mothers know that our bodies are very clever and we're made to provide for bub.
That is very cool, actually.
Yes, would you like me to explain some ways you can express your colostrum, both antenatally and postnatally?
I guess there's no harm, why not?
So hand expressing can be started from 36 weeks gestation, but also can be started after childbirth, and it is a great way to not only stimulate your breast milk production, but has similar effects to breastfeeding by releasing a hormone called oxytocin. This helps with the milk letdown. I understand you're worried about low supply as your mother and sister stopped breastfeeding after 2 days.
Yeah.
But it's important to note that typically breast milk will start to come in from anywhere between 2 days and can take up to 6 days after birth.
Wow, I did actually not know that. I guess taking up to 6 days for your breast milk to come in is normal. I'm definitely more inclined to try breastfeeding for longer than 2 days now that I know that that's normal. I may as well give it a good go.
Yeah, that is so good. I'm so glad you feel more comfortable about breastfeeding. Look, there are also antenatal breastfeeding classes you can attend with other women seeking similar support, where you can ask registered midwives and lactation consultants more questions about breastfeeding. Do you want me to send you the links after our phone call?
Yeah, actually, that's a good idea.
Amazing. So now that we've discussed breastfeeding and talked about some benefits and also strategies to manage sleep, do you feel like breastfeeding might be an achievable goal?
Well, I'm still unsure if I want to breastfeed, to be honest. It sounds like there is a lot involved, and although there are benefits, I guess I've learnt some things from what you have told me, and I am open to having more of a think about breastfeeding as an option.
Good. Well, I'm here to support you in whichever decision you make.
That actually means a lot. Thank you for supporting me. I feel like I can trust you now to discuss what my true thoughts are, because you encourage me to choose what I want at the end of the day, not what somebody else wants. If I did choose to breastfeed, is there any support available?
Oh yeah, definitely. There are lactation consultants available, as well as postnatal midwives that can assist you while you're in hospital. And once you've discharged home, you'll have the support of a child and family health nurse who you can visit at your early childhood centre. Or you can just seek support from private midwives to ensure that you have all the support you need.
Well, now that I've got more information, I do feel a little bit more equipped and capable to breastfeed my baby. I also now understand that breastfeeding is going to be different for every mum and even every baby, and that's actually encouraging information. I guess just because it didn't work for my mum or my sister or any of my friends, that doesn't necessarily mean that it's not going to work for me.
Yes, no, exactly, Zara. I'm so glad to hear that. And look, you are so very capable, and I'm here to empower you to make the decisions that you decide are best for you and your baby.
Well, I really appreciate it, Talia. Thank you very much for all your help. I do feel like breastfeeding is an option, but I'm still scared about the pain and all the things that are involved, especially if it doesn't work out. But after this conversation, I feel like I want to take these thoughts away and discuss them with my partner before making a decision.
Yeah, that sounds like a good plan. Why don't we touch base next month at your appointment after you've had a chance to think about these things further and discuss them with your partner?
Yeah, that sounds like a good plan, actually. Thank you so much.
No worries. Feel free to call me between now and then if you have any more questions or things you're unsure about. Is there anything else I can help you with today?
I don't think so. That's probably all for now. Thank you for listening to me and for answering all my questions. And I do look forward to seeing you in a month at my appointment.
Oh, me too, Zara. Have a lovely day.
You too. Thank you very much. Bye-bye now.
Bye.